We, again, try to look at this from the point of view that actually, although no other barn door symptoms of COVID, the person's contacted Sheffield Community Contact Tracing on the basis of her anxiety. We acknowledged she was 74. She'd realised that there were issues for her, both in terms of lifestyle, in terms of mixing with her grandchildren. She realised there were issues around her health and weight, and realised she was in an at-risk group. So something of both behaviour and circumstance was apparent to her. We'd looked at trying to reassure, but acknowledge the fact as well that it became a broader issue and discussion around the idea that this particular scenario would probably identify itself with an awful lot, hundreds and hundreds of tests that actually take place every day in the UK, where people are looking for reassurance out of testing, not because they're necessarily overtly symptom presenting, but just because they want their anxiety managed. Testing isn't the best way of managing anxiety. So we had this view that potentially, contact tracing may actually support people like this, perhaps if she ended up not being COVID positive, in terms of obviously reducing some of her anxiety. She's having a conversation with a real individual, offering support and advice about her presentation. There was also a practical point based on her temperature of, was there somebody within her immediate bubble perhaps who could drop off social bubble a thermometer, so we could actually check that actually out, and maybe some degree of helping her understand what is less risky versus more risky in general, if we presume that she may not be somebody that we continue to work with if this person doesn't present as being COVID positive. I'll park there because there's probably lots of points that other people would want to make.
Great. Any additional or other points from group 2?
Which was group 2, Mike? How do I identify which group?
That was ours. That was our breakout room. Anyone want to say something from? We had a really good time, but apart from that.
Oh, we didn't do that scenario, did we? No. That was the one we didn't do.
Oh, I see. I thought we were going on to, yeah. Sorry.
Okay, so nothing from your group, Tom, on that scenario. Bing was in a different group, so maybe your group.
Somebody else.
Nick? Well, Mike stole our thunder, really. I got distracted by the two risk factors of diabetes and overweight, which they sort of don't count in the criteria, because what counts is the criteria is symptoms and risk activities, like the kind of work you do, or and so forth. But we dwelt on the question that Mike raised about reassurance. Yeah, that's it, I think. Anybody else? No.
I think it also raised a question about being eligible for the study versus offering human support to people who are feeling scared. And how far do you go with that? Do you ring people another day, even though they don't have the eligibility for the study, but because they're worried and scared, and maybe they need to know which direction to go? We found that with number 3 as well, that the person may have difficulty making a decision about whether to report her employment situation or not. So I guess that's we were touching on that as one of the many elements of support that we offer to people about how to make these decisions, rather than just telling them what they should be doing.
Thanks, really useful. I'm going to remember one other bit on that before we move on to the other 3, which was that there was a suggestion we could use the primary care network to get somebody to check her temperature if that was unclear. That was another suggestion, which is always good to have in our systems. That PCNs have got a dedicated home visiting team, but I'll just drop that into the ocean and then move on to feedback. If we start off with Tom's group, maybe on scenario 2, the school teacher who was feeling off colour and anxious.
I mean, there were some similarities, really, weren't there, about anxiety management, and also Steve was pretty tough on this and said it wasn't going to, hit the not to be acceptable onto our study because it wasn't, it wasn't clear COVID. But I think we were working towards actually ringing the next day when it might be a bit clearer what the symptoms were and whether they were developing into something that was, more likely to lead to a diagnosis. But that second call, is exactly what Rosemary said about being, the human response to a bit of support, even though they don't join in as one of the 20 or 25 on the study. Anybody else from our group?
Well, we were going to send Ollie, who was the teacher, off into isolation away from his home, maybe, if it was possible. So the suggestion was, with his own children and his wife being highly vulnerable, that they need to be separated off. So he was waiting for a test result, wasn't he? But we thought maybe it might be better for him to try and find somewhere alternative to be rather than her, because she's more vulnerable in the kids' routine and everything else. It'd be better for him to, if he could, find somewhere else to live for the next couple of days.
Really useful input. Anything from the group that was with Bing?
I think similar.
Yeah, I think it's really good to distinguish the difference between people being at risk of getting COVID, like the wife was, and risk of exposure. And in his situation, we just generally thought that he needed lots of advice about household care anyway. Even though he wasn't anything to do with the study, he still needs to know all about the at-risk individual and what to do in the bathrooms and the towels and all that sort of stuff.
It's a real core bit for somebody like this, isn't it? All of those how to reduce risk on a daily basis, because whether he's got it this time or not, there's going to be a time in this pandemic where with a wife with chemotherapy, it becomes very relevant.
Also, I think he needs to get a mask, not a visor.
Thank you for such specific and clear advice, which I think
people think they're protected with visors. They're not.
The medics amongst us will thoroughly agree with. And hopefully everybody else will agree with as well. But yes, that's really clear and useful. Mike, I'm assuming from my crib list that we haven't got anything from the group that we were both in.
I think no, it was the only thing Mike was just picking up on. I think it's been identified that this may be very different, as Tom was saying, a day later. But in terms of his initial contact, he's talking about being off his food for the past day or so. We felt it was important to clarify: was that just anxiety-related, lack of appetite, or was that because he'd got a barn door sort of symptom in the sense that he'd lost his sense of taste and smell, really? So it was just a point of clarification.
Can I just say something about this? Both Steve and Carrie took the part of the people doing the telephoning, and just how important the style of what you're, it's not just what you're saying and how you're filling in the forms and things like that, and notching through the questions on, from the manual, as it were, but just the way of talking to someone is just so important. And it was really impressive to see Carrie and Steve at work, really. And I think that gathers more information than a strict going through the number of questions. And you'll have an opportunity the next day to go back and ask the questions that you forgot the first time.
Really important advice and reflection there. Thank you. Does that bring us on to scenario 3, the care worker? And I'm going to give the game away and say with the dodgy care home management. And we could start with the group who were with Bing, but Bing's not at his screen, so it's going to be somebody else from that group. Nick.
Yeah, Okay, so we were very upset about the attitude of the people in the care home, and I know this was something that really bothered you in the first study that it cropped up. So we knew that she was home. It doesn't really talk about anybody else at her home. It's really about the dilemma of you know, what she should do, that she faces about what she should do. And so you would need to be sort of, and she may well not want to say anything. You know, she may well want to do as she's told. And so our job is to, first of all, sort of, we didn't role play it. Maybe we should have done now that Tom's just said that. But
I think we saw this as a safeguarding issue, which meant that
it's practically,
had to come out. The question was finding the best and the quickest way for that to happen without actually helping her lose her job. But it did have to come out one way or another. And it was how you might do that.
Yeah. So the best thing would be if she told public health, the council, about this scenario, and test and trace would escalate it, but it would be better and quicker, and better for the other people in the care home if something was done quicker. But she may not want to, and then she may not give them. If she let slip the name of the care home, then the call handler could make that call to public health at the council, and in a public interest. You know, it's our duty of care to do that, but it'd be better if it was her. And then there's always the option of bringing up the next day and seeing how she's doing.
I don't think you should even do that. It's got to be done with her permission, basically, escalating it. We haven't got any legal backing. And my view would be that you try and mentor her to think about all her contacts. You could talk her through it, because she is going to get asked it by the National Test and Trace, and also try and facilitate her ringing up public health herself, and also not to forget other contacts. I mean, the danger is to focus just on the care home issue, which I know is very important, but also what her household situation is, and you know, what other contacts she's been having in the time period when she could have been infected. Because you know, you're not.
Yeah. Thanks, Fran. Sorry to cutting in. The more general point about how does a volunteer contact tracer get, you know, to the help with this? It was just that there is always support within the system, you know, within the support group or with other people from the steering group to get help with understanding this and to know what the next what the next step is really. So that was just a general point really for people.
Louise and then Bing.
Just because I was role playing the care worker, and she is feeling pretty rough actually. So, and Carrie suggested that I contacted the GP, which, because she's got quite a lot of symptoms, hasn't she? And she to focus on her own health a bit.
Bing?
Just to signpost people to the section in the training manual, which covers outbreaks and care homes and that sort of thing. And there are a whole series of things which you could, as Fran says, direct her to use if she possibly can, including the council's line, there's a PHE line, and then we do have our own escalation system, which we can put things through. And it is difficult if somebody's ill and unwilling to make a fuss, but you see a potential public health issue outbreak, thing there. So it really is important that we have a system to support people and to enable escalation of more difficult situations. And we do have it, it's there.
Gary?
Yeah, I'm just looking in the chat, and Wakas has put home visiting team as part of a pilot at Seven Hills PCN, which the CCG has invested in. They are planning to open it into the wider city PCNs. So, well, in what situations would that home visiting team visit then? Is Wakas here still?
Yes, I am. It's home visiting team is not for COVID-19. It's as if there is, because of COVID-19, everything went online, and the people who they have some concern, they can't come out to GP surgery, or the surgery itself, health professionals have some doubts about their health and they haven't been in contact for some time. So this is the best way for them to ask home visiting service to drop by and check on them. So that's what it is for. But as in that scenario, it was one of the things, if the lady couldn't come out, she don't drive, and she can't take her temperature, it would be good. And she had diabetes, and there are other illnesses. In that way, they could visit her, do that, because they have appropriate PPE. They don't come into surgery. They are separate service. So that was one of the things could be done. With the case as with this worker who care home worker, one of the things which I suggested was that she could talk to her own GP, because yes, the person who is about her own health, and the GP could maybe take it further, because if she positive, I've been told that it could be on your system, but if not, at least GP need to know it's her own GP where her health is, and looking at that, if she's worried, she can explain this to GP, and if they want to take it, they could contact the care home and say this person needs to isolate. Brilliant. So I think that's one of the things.
Yeah, that's the way.
I'm going to move. I'm aware that we're at 2 hours now, and we were planning to finish around now, but we haven't fed back from the fourth scenario. It'd be really lovely to have some quick feedback on that. And Mike, do you want to start that off from the first group?
Yeah, we forgive us because we were running a little bit near the edge in terms of time. We recognise in the scenario how challenging and how difficult this was. We, as an overarching theme, made reference to the fact that actually we've acknowledged, and experience tells us over the past few months, that from a community engagement point of view, we want to try and have the right individual or individuals talking to this particular gentleman, and we understand that language is part of a potential barrier to that particular gentleman fully understanding and comprehending what support we might want to give. So in terms of just his, living arrangements, etc., the fact that he has been contacted, the validity of being contacted in terms of what that means, and the authority linked to actually being asked to stay away from work, but really supporting him and his family. They're in a house of multiple occupation, and it's recognizing that the information he gets has to be as clear as is possible, because he's living in some of the most challenging environments. He may well need advice as well in relation to the financial schemes that potentially are currently available or will be available shortly in terms of supporting him, because I'm sure he'll be very, very concerned about wanting to continue to support his family financially. And clearly there was a reference, I think, the fact that he got no symptoms, and depending on his level of understanding, that may undermine his wish or intent to want to stay at home as well, because I'm okay. If I'm poorly, I'll stay away from work, or I'll stay away from my family, and that's a very common presumption that people would have. So didn't have much time to talk about it, but certainly that was some of the bigger issues and themes we started to get into. And
the other groups, to build on that, Carrie?
Sorry, no, it's not really that. It's just wondering, is there any way, I mean, it's supposedly he's uncertain as to whether he's been contacted by test and trace, the national test and trace system. Is there any way that you can kind of prove that you have been contacted by them? I mean, do they give you a reference number or a case number or something that you can go to your boss and say, look, I was phoned up on the 14th of September and this was the case number, you know, in case they think you're winging it or something. And in fact, if he's not got money, it's to prove that he's on low pay and can't get sick pay and that he's eligible for the money. So do you have to have some kind of proof, and does the National Track and Trace system give it to you?
I don't know.
Do you get a text maybe? I don't know.
You definitely get a text when the result of your test gets.
When you test positive, yes, that's how you get your result.
But you get a text, whatever, you know.
No, but I mean, if you're a contact, not an actual index case.
Of course, yeah.
If you've been told to isolate, because in fact you isolate longer as a contact because it takes longer to incubate, doesn't it?
Yeah.
So in fact, your situation is almost worse being a contact, isn't it?
Yeah. Don't know, to be honest.
There's one phone number that might be useful to know that you would get rung up by. I can't remember offhand what it is, but I, you know, I've got it somewhere. But I don't know.
It'd be really nice if somebody could research that and do a quick paragraph so that we knew.
Okay.
It's really useful having a group of brains like this today to identify these things, which are really, it's the little bits that make a difference to providing a complete service. I'm not going to.
I've been on low income quite a lot of times, so I know what it's like.
I'm not going to make a comment about what the service we're trying to arrange compared to another service that has been organised through Deloitte's and other big organisations and the detail that they're trying to go into. But it is those little details that actually help us to provide a service that will work. Tom,
I'm not really volunteering to try and find out what you know about this, but there is another bit of it, which is that if there are scams, how do we report the scams as well, really? So if someone is approached for money or to give their details or whatever, from any community, not just the, you know, black and minority ethnic community. And I don't know if the person who's going to, or the people who are doing that research could add that as well to our manual.
The scams, we did report it to the police.
We did
quite good at it.
We did think about that with our training manual, and we have a system now for asking people to ring the council and confirm with the council that we are a bona fide operation, and they will do that.
Right. Okay. Good.
The answer to the question is Joan is exactly right. If somebody's scammed, been approached for money, ring the police. That's a completely legitimate thing to report, and you can do it online, which is a lot less time consuming than waiting for an answer on the phone. And then I've reported misinformation to Emma Taylor, the comms person that we've had to do. She's not a senior person by any means, but she said, you know, she was a suitable conduit for that kind of stuff. But the police, if it's an outright scam, police.
Steve, you're muted. You're still muted, Steve.
Yeah, the question on phone numbers, that was the test and trace phone numbers for them contacting a case. Was that correct?
Yes.
Yeah, that's right.
Those phone numbers are on the government advice, which I've just accessed via the app. There are two numbers, both 0300 numbers. And it says, if you get local contact traces, we'll contact you from a local council number. If you're sure this is unsure if this is genuine, please contact your local council for advice. So the two numbers are on there. So on the government thing under how test and trace works, just got to scroll down all that stuff. I'll put them on the chat what the numbers are. So
that would be lovely. Although I'm also reminded that we're running out of time, and that our host has got to finish, and that we said we were going to finish 8 minutes ago. So there's a bit of me which says we probably ought to be, and people are dropping off as they have another meeting or even a meeting with some food, all of which can be very impactful. So I think probably it would be good to finish here, because it's good to finish on the really positive note of such a successful gathering and collection of ideas and practicing thinking about things. I've really valued the initial presentations. I'm really grateful for the discussion in the small group I had. So from me, but I think from everybody I did none of the organising. I think we really need to show our appreciation for Tom, who did lots and lots of the organising and needs to occasionally see that, because Tom can hide behind things, and it's lovely to thank him. And Ian for all the facilitation of this today. Enabling having someone who can do tech is a godsend and has really saved us all. So thank you all very much. Many other people have done lots of things as well, the presenters, and all of you who've come and shared ideas and knowledge. It's been wonderful to be with you, and thank you very much.
Thank you.
Bye.
Cheers.
Thank
Bye
you.
for now, all.
Thank you.
Bye.
Stay well, everybody.
Yeah.
Stay well.
Thanks a lot. Thanks, Ian.
Bye.
Wear your masks.
Thanks, Mike, too. Thank you, Mike, for looking after us.
Yeah.
I did nothing. You did.